Shannon. I'm a level 1 nursing student. I think I have your patient today.
Okay, hi Shannon, I'm Brenda. You have Marta Yarn in room 529?
Yes, can I listen to an SPAR report?
Yeah, of course. So she is an 80-year-old female. She has no known allergies. She's a full code. Her physician is Stephen Jolly, and she came in with a stage 3 non-healing ulcer that she has had for about 3 months, and she has unsuccessfully had it treated as an outpatient and was admitted from her physician's office. She has a history of multiple admissions for dehydration and pneumonia. Her last admission was 6 months ago. She's alert and oriented, times 3 and cooperative. She did complain of some lower back pain, aching, sharp quality for about 3 months she's had it, and is usually relieved with acetaminophen. So it is a 6 out of 10 right now. And so we're just going to monitor that and make sure that we try to effectively treat her pain. She has 20/40 vision bilaterally. She is a little bit slightly hard of hearing, and her cranial nerves are intact. She is up with a walker, standby for assistance if she needs assistance walking. She has coordinated gait. She is slow, and she depends on her walker. Her respiratory-wise, she has chest expansion that is symmetrical, clear to auscultate in all fields. Anterior and posterior is diminished in the bases. Her O2 sats are 92% and respirations of a 24. Cardiovascular-wise, she has a sinus rhythm with occasional premature beat. Cap refill is less than 3 seconds. She is warm to touch. She has +2 pulses as expected, a regular apical pulse. GI-wise, her abdomen is soft to palpate, non-distending, non-tender, slightly obese. She has no masses in her abdomen. Bowel sounds are present ×4. Her last stool was on Tuesday. It is brown and firm. She is on a regular diet, except after midnight she is going to be NPO because she has a scheduled surgery for her wound to be debrided. We are monitoring her I's and O's. Her last her last input was 850 mLs, an output of 350 mLs. She had a complete CBC with differential compensative metabolic panel, INR, PT, PTT, and urine analysis for her labs. All came back okay, except for the white blood cell count was off. So that is due to an infection she has. She also had a blood culture done. She had E. coli with a gram-negative bacteria. So we are going to be giving her some medication for that. She's going to be receiving gentamicin, which is an antibiotic.
And I just have a couple questions, if it's alright if I ask.
Mm-hmm.
Why specifically is the client receiving that antibiotic?
So this patient is receiving gentamicin IV piggyback for her E. coli that she has, since it came back positive for E. coli gram-negative bacteria. This is going to treat that.
So what action does this medication have on the body?
It inhibits the protein synthesis in bacteria. So it's going to end up killing the bacteria.
When should you question administering this medication?
So you're you're going to question administering this medication if the client has any hypersensitivities, renal impairments, since it is filtered through the renal system. If they have renal impairment, then that might indicate that they could end up with toxicity. And if they have hearing impairments, well, she is slightly hearing impaired, so or slightly hard of hearing, so we'll keep an eye on that with her. And any neuromuscular diseases.
And does this medication have a therapeutic serum level?
Yes. So the therapeutic serum level is about 5 to 7 milligrams per kilogram per day.
Okay. And what vital signs should we monitor?
So you're going to monitor, as I said, you're going to monitor her hearing. You're going to want to do neuro checks. You're going to want to monitor for any dizziness, nausea, vomiting. We're also going to monitor the peripheral IV site when we go in to make sure that there isn't anything going on there, any inflammation, swelling, or infiltration.
And which physiological parameters should we monitor when the medication is being administered?
Like I said, so you're going to monitor for neurological.
I think I asked that. I'm sorry.
I'm sorry. I don't know.
What interventions must be taught to the client to ensure the medication is administered safely in the hospital setting?
Okay, so we're going to be giving this Q8 hours, and it needs to be diluted. We need to make sure that we check her IV site, make sure it's not infiltrated beforehand, because that would be a counter-indication of giving the medication through IV.
And what about the interventions that should be taught for taking this medication safely at home?
This patient probably isn't going to be giving herself IV medication at home, but if she were to give it at home, we would have to teach her how to do that.
Okay. And what are the side effects and potential adverse reactions?
So, like I said earlier, autotoxicity is a big one. If they have vertigo or hypomagnesemia, that's also one. Muscle paralysis. So you just want to keep an eye on any neuro or muscular issues.
And how will we know that this medication is effective?
So we're going to monitor the white blood cell count. We're going to do a new culture in about 3 to 5 days to see if there's signs or symptoms of infection still, or if that's starting to clear up.
All right, that's all the questions I have for right now. Thank you. Can I watch you give the medication to your patient?
Yeah. Okay, so we're going to go into her MAR. Miss Marta Yarn. So we're going to go into our MAR here and check to make sure that the order is still, she still has an order for the medication. What she does is gentamicin. It is going to be given IV piggyback on Tuesday, 1400. Tuesday at 1600. And it's to be given every 8 hours. So we have our gentamicin. I already prepared it, and I'm sorry you didn't get to see that. I primed the tubing and everything. When you prime the tubing, you're going to want to make sure that you don't have any air bubbles. And you're going to also want to make sure when you spike the bag that you don't touch any of this, because this is sterile. Okay, so that's one thing I wanted to teach you. It's since you didn't get to see that. So we do have the gentamicin. It is clear. There's nothing wrong with it. It has the correct expiration date on here. There's expiration is 9/2020, which is good. And we're gonna go in to Miss Marta's room, and we're also gonna want to check to make sure that the sodium chloride, 0.9%, potassium 20 max is running, because that is her primary and it should already be running. Okay? So do you want to go meet the patient?
Yes.
Miss Marta.
Hi.
How are you doing today?
I'm okay. How are you?
I'm good. I'm Brenna. I'm going to be your nurse, and this is Shannon. She is a student nurse that is following me. Is it okay if she watches?
Sure.
While I hang your medication?
No problem.
Nice to meet you, Marta.
Nice to meet you too, Shannon.
So you always want to wash your hands and put on gloves before you touch your patient. Miss Marta, we're going to be giving you some antibiotics.
Why do I need those?
Because you have an infection. So that's going to help clear up your infection. Did the doctor talk to you about that?
Yeah, I think I remember something now.
Because you have an ulcer on your bottom, so you might have gotten it that way. Okay, can you tell me your name and date of birth? And okay, sorry.
Sorry, Marta Yarn, 1/25/1935.
Okay, and then can you tell me if you have any allergies?
Not that I know of.
Okay. So that is the right patient. We're going to scan it. It came up on here. So we're going to make sure we scan the one that's already hanging, which is the sodium chloride, 0.9%.
So I'm going to go ahead and sign that you administer this.
Sorry, Miss Marta, can you tell me your name and date of birth again?
Marta Yarn, 1/25/1935. No allergies.
You don't have any allergies. Okay. Now that it's verified, we can document. So 125 mLs per hour, which is running. So you want to make sure that it's running at the correct rate. It is running into her peripheral IV site, which is on her right arm.
One other thing you could add.
I'm going to take these gloves off because it's a little hard to type. You're going to want to document the time that it was given.
Okay, so I'm going to go ahead and put my initials and names on. Marta, have you ever received gentamicin before?
Okay.
I have this handout.
That medication, we made sure that that was running. We're going to do
Has someone
the gentamicin injection IV pigback,
So you need to
which
let me
is
know if
going
you're
to be
having
given. have any allergies? Did they change?
Nope, I'm pretty sure I'm fine.
That's pretty awesome.
Marta, you look good for your age.
Thanks. I think it's the hair.
So we're going to make sure that we're giving the right medication at the right time, which is verified, so that means that we're giving the right medication at the right time to the right person. We're going to be giving it IV feedback.
And normally when you first hang an antibiotic, especially one that they haven't received before, you kind of like monitor them. So probably for the next 15 minutes, I'm going to probably hang right here in her room or right by her door and keep an eye on her. It's usually whenever, especially the first time you administer an antibiotic, you need kind of block. So I'm going to go ahead and do some documentation. That way I can stay with you and monitor you for any adverse effects, especially the first 15 minutes, half hour. So, do you have any questions for me? Okay, I know you're probably hungry. You're on
Alright, so you're going to be getting this medication every 8 hours. Are you aware of that?
I am now.
Okay, so we'll be getting it every 8 hours, so someone will be in here, if not me, another nurse, okay?
Okay.
Okay? Thanks. I'm just going to be right outside this door here. I'm going to walk from the door, but I know the student nurse has a few questions for me.
Okay, you always want to have your gloves on. When you're giving medication, you can get them on.
You can power it. Just cut them home.
Okay, so just a couple questions. Were there any pertinent pieces of information you reviewed before
And you're going to want to clean the hub.
One of the things
My hub's not here right now.
Your hub's not here right now. Before you clean it,
It's just a joke.
your hubby,
I look at that, I look at her white blood cell count,
so we're going to want to hang this lower.
ordering the medicine, but I want to make sure I know what's going on with my patient. She did also have some slight hearing issues, so I kind of wanted to, make sure
You're
I
gonna wanna
knew
clean
who's talking
the
to me.
hub.
She seemed to be able to hear me okay.
Get
And
this
we
ready.
got a little bit an assessment on their baseline hearing, so I knew she was having any issues with that. So those are all things I kind of looked at.
Okay, did this information affect your decision to administer the medication?
No, I mean, she really needs the medication.
You don't want to touch it. You want to screw it on.
And did this information affect how you administer the medication? Okay, that's all my questions for now.
All right, thank you.
Thank you.
You're gonna, since the drip chamber is already filled, you're gonna unroll the clamp.
Well, I was like, I heard about Peyton line, I do have, why did I have Peyton see line? I don't think anybody else does.
And then we're gonna set our pump. So you're going to
You wanna?
do channel select.
I don't care who goes, I just do it.
We're gonna do secondary. This is secondary.
You go out.
And then we're gonna put what the medication is, which is the gentamicin. So G, we're gonna go down to G. Just the second one on the pump. Q, 8 to 12 hours. And then we're gonna do our rate, which is 80.
Yeah, select it.
So yes, and then we'll do 80 over 100.
Yeah, you hover over it and it gives it to you. It shows the 80, I think yours is 80 milligrams per 100 milliliters per over 1 hour. I think so. If you hover over it, you can see it.
We're going to do
It's weird. It took me a little while to get there. I forgot to find, do I need to find the secondary too? Before you finish? I kind of hung it without finding it, but it was hard dripping, so.
would be 80 over 100, and we're going to administer over 1 hour. And start it. And then it's going to infuse. We're going to make sure it's dripping. Which it is in the drip chamber. Okay. So you want to wash your hands? Do you have any questions, Ms. Marta?
No.
Okay. Is there anything else I can get you before we go?
No.
You have your call light?
Yep.
Alright, good. So I will see you in a little while. I'll come back and check on you. If you're feeling sick, nausea, vomiting occurs, or dizziness, then just call me and I'll come in, okay? Because that could be a side effect of the medication.
All right. Thanks, Brenda.
Thank you.
Bye, Shannon. Have fun in nursing school.
Okay, so you're going to want to make sure you document your teaching and all that medication. Do you have any questions about that?
I have a couple more. Were there any pertinent pieces of information you reviewed before administering this antibiotic to the client?
Yes. You want to review their allergies because a lot of people, believe it or not, are allergic to penicillin or antibiotics, and that would be contraindicated. Or, you want to make sure that the medication that they're taking is compatible with the medication we're giving them.
And did this information affect your decision to administer the medication?
Yes. If it would have been contraindicated, then we would have called the doctor, held it, and not given it.
And did this information affect how you administered the medication?
No.
I think that's all the questions I have for right now. Thank you.
All right. Thank you, Shannon. Good luck in nursing school.